Hey y'all, welcome back to another episode of DEI in 5. If you are new to my channel, welcome. Thanks for subscribing. Thanks for hanging out with me. Before I get into the content for today, I just want to say that this video may be triggering for some viewers as I'll be discussing sensitive topics as it relates to mental health, depression, self-harm. So please be aware of this. Take care of yourself. If you feel like watching this content is going to be harmful for you in any way, please exit, click out, prioritize your well-being. I'll also be linking some resources below in the description for anyone that needs them, so please take a look at that. But without further ado, let's get into it. So I really want to touch on mental health as it relates to the workplace and the responsibility that leaders and organizations have to ensure that people are being taken care of. We are currently experiencing a global mental health crisis. About 1 in 8 people worldwide, I'm not talking about the States, but worldwide, are living with a mental health disorder. And those are only the folks that either A, have access to resources to be diagnosed, or B, aren't being bogged down by the stigmas associated with mental health. So the numbers are likely much, much higher. I haven't posted any new content in over a week, and it's because someone I love recently had a mental health crisis, and it was really, really scary. I'm glad I was able to be with them, but it was terrifying to know that someone I love and care about and admire so deeply could have left prematurely. And it pisses me off even more so that this desire they had to self-harm was a result of their anxiety and depression being triggered by a toxic workplace. This person was harassed, has been discriminated against, retaliated against by 2 of their managers. And in both instances, they went to HR for support with receipts. They even had allies who also went to HR, and HR pretty much pushed them off onto new managers and said, oh, the new manager will take care of it. And none of the managers that they've have had any formal leadership training, no kind of management skills, not even just the basic fundamentals of how to lead other people, which is so problematic. And this is such a common occurrence across organizations. I see it time and time again. And it's one of the many reasons why so many folks, especially marginalized individuals, don't trust HR, don't trust leadership. It's why we see people leaving jobs, burnt out because they have crappy managers and or managers who are inexperienced and or lack empathy. And HR is just, it really grinds my gears. HR folks will swear up and down that they're there to protect people and make sure folks are okay. But the reality is, and many of us know this, at the end of the day, HR is there to pretty much protect the leaders and stakeholders and decision makers, and to kind of partner with legal to make sure the organization doesn't run into any legal troubles. I said it. That's the reality of it. So yeah, they're not really there for individual contributors, and they're definitely not really there when it comes to underrepresented and historically marginalized individuals. I see it time and time again. The data shows it. I could go on. But fortunately, the person I care about is okay. I'm so glad again that I was able to be there and can still be there for them to support. And it's funny because I myself was in a similar situation a few years back and they were there for me. So it's a bit of a 360 moment. But years ago, I myself hit rock bottom dealing with a job and that wasn't for me, in a toxic workplace. And I was overworked, I was burnt out, and I was in the deepest depression I've ever been in my life. And I pray I never end up there again, but I had tunnel vision. Like, everything around me just felt and looked so dark. I questioned, what I was doing, why I was living. I contemplated self-harm seriously for the first time. All very scary. And looking back, I'm just so thankful that I had just a smidge of hope left in me to seek out help and resources and support from other people. And over time, it's been a journey. It's been years. But over time, things have gotten better. And it's so interesting because now I look at life almost in the opposite way, where I'm like, there aren't enough hours in the day. I don't have enough time. I want to stay as healthy as possible so I can get as much done in this lifetime. And I hope that other people are able to get to that point. There's so much more I could share about my own mental health journey, and maybe I'll create a video later on about that. But I want to get back to what I really wanted to zoom into on today, which is the responsibility that these organizations and leaders have on people, right? Bad and or inexperienced managers cause more harm than good. They can do a lot of damage to teams, to individuals, to your organization as a whole, to the bottom line. If you're really worried about your revenue, which I mean, you kind of have to be, because you can't run an organization if you can't pay people and cover your bills and all that good stuff, right? So when leaders don't prioritize the well being of their people, it creates a toxic work environment, and mental health issues are bound to spiral out of control. So, what can organizations and leaders do to ensure that people are being taken care of? I know I kind of ranted a little bit, but if you know me, I'm all about thinking about solutions and actions that we can take. So, what can we do? Organizations, hopefully your organization is able to provide some sort of benefits, maybe healthcare benefits that offer mental health support. And if not, at the minimum, you should be offering a list of resources to your folks that they can leverage should they need them. You can also consider, and this to me is an easy one, this is what we consider low-hanging fruit, is making well-being a shared value within your organization, one that leaders are prioritizing. That, of course, requires a level of empathy as well as vulnerability from leaders, because 9 times out of 10, leaders have experienced mental health issues as well, but don't talk openly about them. So it's really important. You have to make sure that people are doing well. Otherwise, your organization is not going to do well at the end of the day. Organizations can also work with their HR teams to disprove the belief that we have historically that HR is just there to protect the organization. Prove to us that you care about the people. Do something. If I reach out to you with an issue with my manager, why are you going to my manager? That's HR 101. Why would you go directly to my manager to let them know and create even bigger issues? Doesn't make sense, right? So there is a need for HR folks to do better as well. As far as people managers and leaders, at a minimum, you should be checking in with the people that you are leading and seeing how they're doing. It can't just all be task oriented and do this, how's this, give me an update for this. Slow down for a minute and ask people how they're doing. They are human and they are dedicating hours of their lives, years of their lives to an organization. Take time to ask how they're doing. Leaders can also ensure that you are practicing inclusive leadership. I mean, easier said than done, but shameless plug, the Inclusive Leadership Journal is here to help you jumpstart your journey. So examining your own biases, which, so many people think, oh, I'm going to go to unconscious bias training or workshop, and I know about bias now. It's so much more than that. It is an ongoing journey. You have to constantly be reflecting on who you are, your beliefs, the assumptions you make about other people, how those assumptions impact how you're treating other people, especially your direct reports. If you are not actively doing that and periodically checking in with yourself, your biases are going unchecked, and it becomes a problem for individuals in your team and ultimately the organization. So check your biases. If you don't know how to do that, the Inclusive Leadership Journal will teach you how to do that. I'll add the link into the description below. Other things that you can consider after you've started to check your own biases and check who you are, do that internal work, you then need to start learning about the people that you are actually leading. Who are they? What do they care about? What drives them to success? What leads them to failure? What upsets them? What grinds their gears? What are their lived experiences, and how do they impact how they navigate the workplace? These are questions that you can ask people to get to know them and to better support them and to better support your organization. I promise you, taking a little time to do this work will make for a longer term impact on so many people and on so many organizations. Excuse me. It's also important to think about inclusive team dynamics as well, right? So ensuring that all ideas are being considered and that people have psychological safety. They're not afraid to speak up or to share mistakes or to, push back on something they don't believe in. That is psychological safety. You should be working towards building it. But again, if you haven't checked yourself, it's going to be really hard to do it, and it's going to be really hard to build that trust with your team members. So again, consider the Inclusive Leadership Journal to jumpstart your journey. I mentioned early on in this video, and I'm going to wrap up in just a moment. I'm always pushing over 5 minutes, but we are in a global mental health crisis, and there's also a shortage of mental health professionals. So, to put things into perspective, I just want to quickly read an excerpt from a JAMA Network article, which is a medical news media coverage site. I'll link the article below, but they said, in regard to the global crisis, about 1 in 8 people worldwide, nearly 1 billion, live with a mental health disorder, according to the report. Self elimination accounts for 1 in every 100 deaths and is the leading cause of adolescent death. Yet, on average, governments spend just 2% of their health budgets on mental health care, and low and middle income countries spend just 1%. Roughly half the world's population lives in a country with one psychiatrist for 200,000 or more people. One. The report notes that child and adolescent mental health specialists in many low and middle income countries are, quote unquote, almost non existent. So, we are, again, not only dealing with this mental health care crisis, but we're also dealing with a shortage of professionals. And so, knowing that people are spending so much time in their workplaces, organizations and leaders can step it up to support. It's, of course, not just on you. We as humans, as individuals, we have a responsibility to other people, to our fellow humans, to just offer support. I've found so many strangers have wanted to help me throughout my life, people that there was no benefit other than they just wanted to help me and they want to see me thrive. And I'm so grateful for that, and I hope to offer that resource to other people. But just know, like, we need to step it up. We need to support one another. We can't, especially in a workplace, just treat people like they're just a cog in the wheel or just a machine, and you stamp out your work and do your thing and then you go home. And it's time out for that. We've been doing that. We're at a place now, especially with the results of COVID, where mental health is a lot more fragile and there needs to be a lot more care around how we're treating people. So that's all I got for today. Thank you for watching. Please don't forget to like, share, subscribe. If you want to join the conversation, check it out below, add a comment. And like I said, in the description, I'll add some additional resources for today's discussion. If you're going through anything, you're not alone. So many of us have been there. And it's a journey, right? There's never going to be like some end destination. It is truly a journey to just be happier and to just feel worthy and to feel valued in this world, especially if you're a marginalized individual. It can be so challenging, but I hope you hang in there. I hope you know that you have resources, support. Like I said, I'm linking some below, and yeah, I hope to see y'all back here again soon. All right, y'all, until later. Bye.